One thing we have to understand is that oftentimes the findings on the MRI don't match up to our clinical symptoms. So there's quite a bit of times that we'll get an MRI and the patient's symptoms won't necessarily be related to what we're seeing on the MRI. And sometimes we'll get an MRI that's negative, but the patient still has noticeable symptoms.
Welcome to the Motion Lab, the podcast that explores the science of movement and helps you live a stronger and healthier life.
Welcome back to the Motion Lab podcast. My name is Chuck Dowell. I'm one of the physician assistants here at Colorado Springs Orthopaedic Group. I primarily work in the express care here at the Orthopaedic Group. We wanted to discuss what the express care is. So the express care is a unique clinic that we have at Colorado Springs Orthopaedic Group. It's a walk-in clinic only for orthopedic conditions. So we do consider it kind of an orthopedic urgent care, but if you have a sinus infection and cold, please do not come see us. It is for acute and chronic orthopedic conditions. We do see patients of all ages, pediatric patients all the way up to geriatric patients. It's definitely convenient because nobody wants to have an injury. Let's say you were playing a sport over the weekend and you twist your ankle or hurt your knee. You don't really want to go to the emergency room for that and sit for a long period of time. So the benefit of the express care clinic is that you can walk in and be seen for all those acute orthopedic needs. We do take most insurances, but I would call ahead just to make sure your insurance is covered. And we do accept that insurance, but we also do have cash pay prices. The benefit of the express care is that we try to provide comprehensive care. So we have an x-ray at the facility on site. We have all of the medical equipment that we need as far as casting materials, medical supplies for bracing or splints that may be necessary. We can perform injections if necessary inside the joint or in the soft tissue. And we can also send and refer for further tests. We do have direct access to our orthopedic surgeons upstairs. And so if something comes in that requires maybe more of an urgent orthopedic need or referral, possibly requires surgery, we do and or can have direct access to our surgeons upstairs, and they can evaluate the case and possibly schedule that for surgery. The benefit also is that if you're already seeing one of our orthopedic surgeons and you're having pain associated with that previous condition, and that pain seems to be getting worse, and that surgeon is either out of town or potentially in surgery that day, you feel free to walk into our clinic and we're happy to evaluate you. We have access to all of their notes and can look through your case description and then kind of decide on what the best or most appropriate treatment would be. The clinic, again, is for both acute and chronic injuries. So if you have an acute injury that you were seen at one of the local emergency rooms or urgent cares and x-rays were taken, or maybe your primary care evaluated you and x-rays were taken, we do have access to most of the x-ray systems, but I would recommend that you bring your x-rays in on a disc, as some of the systems we don't have access to and may have to repeat those x-rays. But if you were seen and diagnosed with a fracture and you were put in a splint and potentially they thought that was a non-surgical case that required casting or possibly a surgical case, again, we can see you in the express care clinic. We can potentially put the cast on, or we can get you set up with our orthopedic surgeons to progress for that possible surgery if necessary. So examples of care would be, we're getting into the summer season here in Colorado, so we're seeing a lot of outdoor injuries. Monkey bar season is well within us, and so we're seeing a lot of kids that are falling from the monkey bars and sustaining fractures to their wrist or forearm. They're being seen at the outpatient clinics, whether it be an urgent care or emergency room. The x-rays are taken. They do put them in a temporary splint, and then they come and see us in clinic. With our evaluation, we can decide if that requires surgery or does not require surgery. And then oftentimes we're able to put them in the cast if necessary, and they can follow up with our specialists in the appropriate time period to continue care and continue the evaluation of that orthopedic injury. Or I had a patient yesterday that had a fairly significant fracture, and we were able to set him up with the orthopedic surgeon to have surgery on it, and they were having surgery for it today. So that's the convenience, is that we can accelerate that process if it's necessary to proceed with any kind of surgical intervention for it. Oftentimes, patients come in that are being evaluated by their primary care physician for long-standing pain. So I've had shoulder pain for 3-4 months. I've had knee pain for 3 or 4 months, and I've tried some conservative treatments, including physical therapy, rest, and home, exercise programs, and it's not necessarily getting better. and they come to see us for possible order for an MRI. One question is, do I need an MRI? Oftentimes the case is no. Most of the time, from an orthopedic perspective, we can get a lot of the information we need from a good history of the onset of your symptoms, the severity of your symptoms, the location of your symptoms, and a physical exam can often give us most of the information we need. Again, we do have x-ray on the premises and or in the clinic, so we can oftentimes get those x-rays, and most insurance companies require an x-ray prior to proceeding with an MRI. And majority of the time, through that history, clinical exam, and our physical exam and the x-rays, we can get a lot of the information we need and decide what the appropriate treatment is. Sometimes, though, with acute injuries, so an acute knee injury where we think there's possibly a ligamentous tear, an acute soft tissue injury where possibly a torn Achilles or a torn biceps, maybe you fell and we think you have an acute rotator cuff tear. In those circumstances, we will schedule and order the MRI right away just for evaluation as maybe a pre-surgical test, thinking that's something that may need to proceed to surgery. One thing we have to understand is that oftentimes the findings on the MRI don't match up to our clinical symptoms. So there's quite a bit of times that we'll get an MRI and the patient's symptoms won't necessarily be related to what we're seeing on the MRI. And sometimes we'll get an MRI that's negative, but the patient still has noticeable symptoms. A lot of the times we hold off on ordering that MRI knowing that we all accumulate wear and tear in our joints and our extremities throughout our lifespan. We put a lot of miles on our knees, a lot of miles on our shoulders, and so we know we're all going to have some chronic changes on those MRIs. The question is, are those changes the source of your symptoms or not? And oftentimes they're not. And so that's why a lot of times we'll hold off on the MRI until we fail conservative treatments, including rest and over-the-counter medications, physical therapy type activities, and possible injections. But if they have failed those treatments, then the MRI is a modality we can use to evaluate what potentially still is going on, and if that's something that may require further treatments, such as surgery if necessary. A patient I saw the other day who had injured their knee approximately 3 months ago. They were squatting down to kind of pick their young child up, and they felt a twisting and popping sensation in their knee. They'd seen their primary care physician about it, and it wasn't potentially getting better. They had tried all these conservative treatments, including the rest. They had tried some physical therapy for about 6 weeks. They had tried different over-the-counter anti-inflammatory medications, and their symptoms weren't improving, and they were actually potentially getting worse. By the time they saw me in the Express Care clinic, they were having recurrent swelling within their knee anytime they did any increased activities. Their physical exam was consistent with concerns for a meniscus tear, and so we did send them for the MRI, which did show that they had a meniscus tear, and they were able to follow up with our sports medicine doctors and appropriately schedule surgery to get that resolved. Another similar example is pickleball. Pickleball is a common sport that we see often here. I had a patient last week who came in. They were lunging to go hit the ball back over the net, and they felt a popping sensation or a tearing sensation within the posterior heel area. They said it felt like somebody had kicked them in the back of the leg. With examination, there was concern about their Achilles was torn. That's one of the situations where we get that MRI right away to confirm that Achilles tear. And again, they then were able to follow up with the appropriate surgeon to discuss the possibility of need if treating that with or without surgery was necessary at that time. Oftentimes, people come in and requesting an MRI. And again, I think it's important to understand sometimes this is required and sometimes it's not. Sometimes your insurance does require x-rays prior to proceeding with this, and sometimes they do require you to fail conservative treatment. So with low back MRIs, a lot of the times, your insurance company requires you to go to 6 weeks of physical therapy prior to authorizing the MRI, because they know a majority of the time your symptoms will get better with that physical therapy. So again, regards to the Express Care, we are open from 9 to 5 during the weekdays and 8 to noon on Saturday. It's a walk-in clinic, no appointment necessary. And again, we're there available for both acute and chronic conditions, any type of injury, musculoskeletal injury that you have. Again, convenient that you don't have to necessarily go to the urgent care or emergency room, but if you have been seen by the emergency room, urgent care, or primary care and referred to orthopedics, and potentially it's taking longer than you would like to get in to see that orthopedic group, feel free to walk into our Express Care and we can start the workup for evaluation on, what's going on for your injury. So again, what to expect when you walk into the Express Care clinic. You'll check in with our front desk staff. You'll be brought back to the room with one of our medical assistants. They'll take a brief history from you. Again, majority of the time, if you've had x-rays in another clinic, we can have access to those x-rays. But if you're coming in to see us, ideally, if you can bring those on a disc, that will prevent the need from possibly having to repeat the x-rays if we don't have access. If we do repeat the x-rays, those will be performed, and then you'll be seen by one of the providers. The Express Care is staffed by our physician assistants or advanced practice providers, but we do have our orthopedic surgeons with direct access for discussions on cases that could be more complicated or require more acute treatment. We have the access and availability to provide any bracing, casting, or splinting as necessary. We can, again, perform joint injections and soft tissue injections if necessary. And then if we feel like there's a need for further imaging, we can order the MRI or CT scan. If we feel like there's possible a need for further evaluation by one of our other specialists, we can then refer you to those specialists for that evaluation as well. It's a convenient service that provides comprehensive orthopedic focused care in a more streamlined system and allows direct access to our orthopedic clinic. We do see all ages, so from pediatric patients to geriatric patients, and we do see both acute and chronic, all musculoskeletal injuries. So please feel free to come into the Express Care for your evaluation. Again, call ahead to make sure that we do accept your insurance. And again, we're open Mondays through Fridays from 9 a.m. to 5 p.m. and Saturday from 8 to noon.